Hi there, science fans. My name is Dan Casciano, and you are watching Science and Other Stuff for Senior Citizens. This channel is dedicated to promoting science that is understandable to non-scientists and is primarily directed to senior citizens, as well as anyone interested in increasing their understanding of science. I would be very pleased if you subscribe to this channel and also ring the bell to be reminded when new episodes are published. In the previous COVID episode, I presented the structure and function of COVID-19 and also a short discussion on how the human immune system functions to combat that virus. Please click the link to view that YouTube video. In the present video, I will discuss the damage that the virus inflicts on the human body and also discuss how a 1% mortality or fatality rate can result in the destruction of our healthcare system. It is for this reason and the health of our entire population that the Centers for Disease Control, CDC, has instituted a set of guidelines that can decrease the virus's infectivity and ultimately prevent further damage to the human population. These are the data that motivated me to develop the present video. It is clear that while the rest of the world has provided the necessary tools to their population in order to flatten their infectivity curve, the United States has not. It is also apparent that the initial states' efforts to do this had an early positive impact. However, the present surge in cases has been attributed to an aggressive early opening of their economies because of assumptions made by those states and by not complying with the CDC recommendation for successful phase openings. Many health officials suggested that the surge could have been modified or eliminated if the CDC guidelines of wearing masks, social distancing, and avoiding large gatherings in confined indoor places were followed. First, we should understand what constitutes the COVID-19. COVID-19 is the name of the disease caused by the new coronavirus that is called SARS-CoV-2, or sometimes referred to as the novel coronavirus. A novel coronavirus is a new coronavirus that has not been previously identified and to which humans have no antibodies or immunity. COVID-19 is not the same as the coronaviruses that commonly circulate among us and cause mild illnesses like the common cold. A question that is often asked is whether the flu virus is the same as COVID-19. Scientists have shown us that the flu and COVID-19 viruses are both contagious respiratory illnesses, but are caused by different viruses. COVID-19 is a new infective virus called SARS-CoV-2, while the flu is an influenza virus. Since humans have been exposed to many different flu viruses, we are probably contain antibodies or T-lymphocyte memory cells that could be helpful in warding off or at least minimizing new or different flu viruses. However, since the COVID-19 is a new virus that the human has not been exposed to before, protection can only be achieved by infection and the host responding by developing antibodies to the infection, or to be protected by a vaccine manufactured to mount a defense by the host. Although flu and COVID-19 share many characteristics, there are key differences between the two. This slide shows many of the symptoms associated with COVID-19 infection. These symptoms can appear 2 to 14 days after exposure, and this time after exposure has been called the incubation period. Some of the common symptoms include fever, cough, and tiredness, and loss of taste or smell. Other symptoms include shortness of breath or difficulty breathing, muscle ache, sore throat, runny nose, headache, and chest pain. Other less common symptoms include rash, nausea, vomiting, and diarrhea. This slide depicts the increased risks to humans who have underlying health issues. Individuals that have serious heart disease, COPD, type 2 diabetes, severe or moderate obesity, chronic kidney disease, sickle cell disease, and weakened immune system from solid organ transplants all are more sensitive to the infection, and depending upon the comorbidity, a greater chance for hospitalization and ending up on a ventilator or even death. Other conditions that may increase the risk of a serious illness include asthma, liver disease, brain or nervous system conditions, a weakened immune system from bone marrow transplants, HIV, or some medications, as well as type 1 diabetes and hypertension. When should one see a doctor? A doctor should be seen when one has trouble breathing, has persistent chest pain or pressure, experiences the inability to stay awake, and experiences a new confusion or has blue lips or face. This slide and the next two slides present information that is somewhat hypothetical in nature because scientists and physicians have not yet settled on a mortality or true infection fatality rate. Early on in the pandemic, the mortality rate, the percentage of infected individuals who die from COVID-19, was around 3.4%. This meant that for every 100 people infected with the virus, on average, between 3 to 4 would die. However, while the CDC has a best guess of 0.65%, current estimates fall between 0.2% and 1%. If we consider the highest estimate of 1% to be the rate impacting on our health system, the estimates in the following slide would have validity. One needs to consider the large number of Americans who can be infected, approximately 350 million. Also, one needs to consider that the outcome of these infections is not binary, that is, to die or not die. The data indicate that some survivors will suffer long-term hospitalizations, permanent lung or heart damage, and other debilitating diseases. All of these outcomes result in catastrophic impacts on our healthcare system. The question would be then, how can this small infection mortality rate have such a large impact on our society to warrant shutting down our economy? The following slides attempt to answer that question. For every single person who dies from COVID-19, 19 more will require hospitalization. 18 of those will have permanent heart damage, and 10 will have permanent lung damage. 3 will have strokes, 2 will have debilitating neurological damage that leads to chronic weakness and loss of coordination, and 2 will have neurological damage that leads to loss of cognitive function. To quantify this, 3,282,000 people will die. 62,358,000 people will be hospitalized. 59,076,000 people will have permanent heart damage. 32,820,000 people will have permanent lung damage. 9,846,000 will have strokes. 6,564,000 people will suffer muscle weaknesses, while 6,540,000 will have loss of cognitive function. Although a 1% mortality rate seems small, in reality, the impact on our national health system would be catastrophic, resulting in being overwhelmed, leading to systemic healthcare failure. This slide summarizes guidelines issued by the U.S. CDC. They recommend what precautions we should be taking to reduce the probability of COVID-19 infection. They include cleaning and washing your hands often, avoiding contact with sick people, practicing distancing, keeping 6 to 10 feet between you and the other, avoiding crowds outdoors and especially indoors, wearing a mask in public settings and when around people outside of the household. Wearing masks have been shown to greatly reduce being infected by people who have COVID-19 and spreading the virus to others. For more information about science, visit my website at www.dcasciano.com. If you have any questions or would like me to develop a video on a specific science subject, leave them in the comments below or email me at dan@dcasciano.com. Be sure to like this video and subscribe to my channel and ring the bell so you can be informed when I upload a new video. Thank you for watching Science and Other Stuff for Senior Citizens. Bye.